Greetings and welcome everyone to today's WorkQuest CRP Compliance and Training Seminar. My name is Dave Clark. I'll be your host today. Before we get started, there are just a couple of things I'd like you to know about. First of all, this will be a very interactive event today. We'll have a Q&A session at the end of each of the presentations, and if you have any questions at all, you can type them at any time into the Q&A box that you'll find on your screen. We're interested today in all of your questions, so be sure to get all of them into the Q&A box, and our presenters today will try to answer as many of them today as they can, I promise. Also, you can use that Q&A box that you'll find on your screen to communicate with me during the event today if you're having any technical issues or problems. Just let me know what's going on, what kind of issue you're having, and I'll do my best to help you out. All right, well, let's get started. Our first presenter today is Kyle Radford, Director of Business Development at WorkQuest. And with that, I'm going to turn it over to you, Kyle. Take it away.
Thanks, Dave. I appreciate it. And thank you, everyone, for logging in today and participating in this webinar, our 2019 Compliance and Training Seminar. We've got a lot of good information today. This is a great opportunity for us at WorkQuest to kind of talk about what's going on with the state use program, what's happened in the last year, what changes the Workforce Commission has implemented. We're going to talk a little bit about the advisory committee and some legislative updates, things like that. Everything that is required of you as a CRP to remain in good standing to be in compliance with the state use program. So a little bit about what we're going to talk about today. Our agenda, we're going to go over the state use program update. It'll just be a little update about what's going on with the program. Then we're going to talk about the Workforce Commission, their purchasing procedures and rules, talk about the advisory committee a little bit. The advisory committee's met and not implemented, they've voted on some performance measures for the program. So we'll talk about those performance measures. We're going to go into TWC staff desk reviews. I'm sure a number of you attending have had a desk review where TWC staff actually comes out and reviews some of your compliance material. So we'll go over that. And then I'll give a brief legislative update about what happened, what changes there were that will affect the state use program. Then we're going to move on to state use participation requirements. That's everybody's favorite, the most exciting portion of what we do as members of the state use program, our recertification, that quarterly state use wage report that you fill out, the documentation of disability forms that you have on file for all of your individuals with disabilities, your CRP set-aside agreement, and then the CRP web portal, how you can actually submit some of this information online through the WorkQuest website. After that, we'll go into state use product and service contracting, talk a little bit about what's going on with product and service contracting, go over cost analysis forms and value-added requirements. When that's done, we'll have a Q&A session, and then you will be done with me, and we'll take a break for lunch. And then at 1 o'clock, we'll meet back here on this webinar to have TWC VR staff talking about competitive integrated employment training. And then at 2 o'clock, not what your agenda says, this is actually the agenda for the regional seminars that we've been doing where we have a CRP roundtable talking about employee recruitment. We've actually got another presenter from TWC talking about waivers and community-based employment services for individuals with disabilities. So that'll be another great session that TWC VR has volunteered to do for us and to present to CRP. So we appreciate them doing that. So without further ado, let's move on. First of all, a little bit about the state use program. What is going on with state use? Well, first of all, if you're wondering what WorkQuest is and who I am, to celebrate our 40th anniversary, TIBH decided to change its name to WorkQuest. We thought that better represented our mission of employing individuals with disabilities. So we're excited to roll this out. With that, we rolled out a new website as well, workquest.com. So you can go to workquest.com and check out what's going on with the state use program. I'll be talking about it a little later. There's some good information there for CRPs and ways for you to participate in the program as well. So if you're wondering what WorkQuest is, it's just TIBH, just with a new name. So if you were at our Ardley Hines banquet last September, that's where we rolled this out officially. So we've had it about a year now, and I think it's been a great change for the company. Okay, a little bit about the numbers. for last fiscal year. This was what was reported in the annual report. So we compile all that information that you submit via your state use wage report, and then TWC makes their annual report and includes that information to the governor and the legislature. So last year, we had over 6,000 individuals with disabilities employed, and those individuals earned over $44 million. So that wage amount was an increase over the previous year. Almost 1,600 individuals without disabilities employed, earning over $15 million in wages. And then CRPs outplaced 1,406 individuals with disabilities, and there were 107 CRPs participating in the program. So with these numbers, we remain the second largest state use program in the country, just below New York State. And I always like to say that the New York State program doesn't play fair, because their political subdivisions are a mandatory aspect of their program, and they have the city of New York as their main customer. So if we had the city of New York as our main customer, we'd be the #1 program as well. But we are right up there with them, and this continues to be one of the strongest programs in the country. So we appreciate all the work you CRPs do employing individuals with disabilities and working with us and the customers to make it such a strong program that everybody else really looks up to. This is just the breakdown of types of disabilities that are served through the program, those 6,013 individuals. Again, this is information that's reported on your state use wage report. So we appreciate you filling those out, and we're going to talk a little bit more about some changes to that report and some changes to that process a little bit later. But first, let's talk about the Texas Workforce Commission. For those of you who do not know, TWC is our oversight agency. In 2015, oversight of the program was transferred from the Texas Council on Purchasing from People with Disabilities over to TWC. It's been a good partnership. They have done a lot to strengthen the program, really upping their monitoring of compliance, trying to get out there and meet with CRPs, trying to speed up the process of how services and products are approved, and then working with the advisory committee. TWC is a 3-member commission. They're all appointed by the governor. There's Chairman Hughes, who represents employers. Commissioner Alvarez represents labor, and right now the 3rd spot, who represents the public, that commissioner is vacant. So we are awaiting the governor to appoint another commissioner, but they continue to meet, and we're continuing to try to get products and services approved. But we are hoping that that 3rd commissioner will be appointed shortly. We were thinking they were waiting till after the legislative session, and now that that's over, we're hoping to get that appointment. The responsibilities of TWC, if you remember the council, they're very similar to the council's responsibilities. They write the program rules. The last time that TWC opened up the rules was about 2 years ago. They made a number of changes. They are looking to open those rules back up and write some new rules. So we at WorkQuest will keep all of you CRPs aware of when that happens. The rules will go out for public comment. You'll be able to make your comments on the rules or any suggestions you might have. But that is a process that they're looking at. They contract with the Central Nonprofit Agency, or the CNA. That's WorkQuest. So we are 1.5 years into a 4-year contract with TWC to administer the day-to-day activities of the state use program. They certify and recertify CRPs. Something new that they've been doing for the last 2 years, performing CRP compliance desk reviews. That's where TWC staff will come to your CRP and actually review some of your paperwork with you. And then one of the most important functions of TWC is approval of products and services. That is how we actually employ individuals through this program. And they do get assistance by the comptroller. So the comptroller is reviewing all of those services and specifically all of those products to make sure that we're not in conflict with any state contracts, and to see do some competitive pricing research to submit to TWC. The program has 2 staff, Kelvin Moore and Howard Joseph. This program is officially called the Texas Workforce Commission Purchasing from People with Disabilities program. So you might hear Works Wonders, it's branded that way. You might hear PPD program, you might hear the TIBH program. All that is state use. That's the state's initiative to employ people with disabilities through the purchase of products and services. So it has many names, but that is all under the state use program. In 2015, when TWC became our oversight agency, something else that happened in legislation was an advisory committee was formed. It was required by Chapter 122, and it was very specific about how it be made up. It's a 13-member committee, 4 members representing CRPs, 4 members representing advocates of individuals with disabilities, 2 individuals with disabilities, 2 individuals with disabilities employed at CRPs, and then the executive commissioner of HHSC or that person's designee. So it's a large committee. They meet semi-annually at least. Traditionally, they've met much more often than that. They actually haven't met this year, though. I think they were taking a break during the legislative session. So there should be some meetings coming up, and we'll keep you aware of when those meetings will be. They're usually here in Austin, and they're open public meetings, so you're invited to attend, listen, and make any comments. But what the advisory committee does is they make recommendations to TWC. They don't set policy, but they do make recommendations, and then the commissioners will use that information, use those recommendations to make any necessary changes to the program. And that's something that they would do traditionally through the rulemaking process. So they make recommendations on performance measures for the program and CRP certification requirements. So the performance measures could be for you all, the CRPs, they could be for the CNA, they could be for the program as a whole. They have been meeting a lot to talk about those performance measures, and then the advisory committee actually has drafted a number of measures that they've submitted to TWC for their consideration. Now, TWC hasn't adopted any of these measures yet, but I want to go over what the advisory committee has sent to TWC. I think it's important for you all to understand what they're talking about and the performance measures that they are setting and TWC is considering. So first, we'll look at the performance measures for CRPs. Now, these performance measures were passed last November, and as I said, they're not yet adopted by TWC. Could be something that is worked into the rules, though, when they reopen those rules. First one would be the percentage of individuals with disabilities participating in the program that are placed in competitive integrated employment. As some of you or all of you may know, that competitive integrated employment is the big push for the Texas Workforce Commission and VR and a national movement as a whole. So the advisory committee is looking at those individuals that are using this program as a stepping stone and being placed out into competitive integrated employment. So they want that reported quarterly, which is actually something you all are already reporting on your state use wage report. And the target is 4% of employees in the program per year will be placed into competitive integrated employment. The second CRP performance measure would be the number of hours delivered of career counseling services or training or professional development or education opportunities that would assist employees with disabilities advancing within the organization or accepting competitive employment outside of the CRP. So these would be employment services or training that you provide to your employees with disabilities. It would be reported quarterly. That's not something we're currently tracking. And it would be 1 hour of training provided to your employees per quarter. So as you can see, TWC and the advisory committee are really looking at the services that are provided, the employment services provided to individuals with disabilities as a part of this program. That's it for CRP performance measures. Moving on to performance measures for the CNA. Again, that's WorkQuest. These were adopted at that November meeting and also have not been adopted by, or they were passed at that November meeting and have not been adopted by TWC. So the first one would be the number of hours offered of career counseling services or training or professional development or education opportunities conducted for CRP employees with disabilities participating in the state use program where the CRP cannot provide the above. So those hours that the CRP performance measures we're talking about, those training hours, if you as the CRP cannot provide that training or that career counseling to your employees with disabilities, then this performance measure would ask the CNA to step in and provide that training for your employees, and that would be reported annually. Number 2, the number of classes and training developed and published for use by CRPs for employees with disabilities. So this would be training classes that WorkQuest develops or contracts with someone to provide to your employees with disabilities. So if you'll remember to last summer, we did training on person-centered planning and services for people with disabilities. That would count as one class. So we'd report that annually, and the target would be 4 of those trainings per year. The third performance measure for the Central Nonprofit Agency is to increase employment hours paying minimum wage or higher for individuals with disabilities. So this relates to those CRPs who are paying less than minimum wage, utilizing a 14C certificate to pay a commensurate wage. We would report that annually, and the target is 97% of all hours worked in the program must be minimum wage. That would be all direct labor hours would be at the minimum wage or higher. That is actually a target that we already hit as a program, but that is what they're looking at for that performance measure. And then finally, number 4 for the CNA performance measures, the Central Nonprofit Agency, working with the Texas Workforce Commission, will work to improve customer satisfaction with products and services by conducting a survey. So I'm sure you're aware that we've been sending out surveys. This is something that's now required of WorkQuest by Texas Workforce Commission to get a feeling of the purchaser, some purchaser feedback and CRP feedback on the program. So this is something we have to do semi-annually. Specifically here, this is asking our customers about satisfaction with products and service. And the target would be 90% satisfied. And that is a goal that we have hit in our previous surveys. So that's what they're looking at for our performance measures as a part of this program. Again, nothing has been adopted yet, but that is what TWC is considering. Again, I encourage everybody to attend those advisory committee meetings whenever possible. This is how it all works. If you were confused before, here's a confusing chart. You've got the Workforce Commission up there at the top. They are our oversight agency. They consult with the advisory committee, who gives recommendations on performance goals, certification criteria. They're reviewing all of your products and services and setting the fair market price. Then you all as the CRPs deliver those products and services to the customers, and we have agency oversight. WorkQuest is the central nonprofit agency is working in the middle with the customers, the CRPs, and the Workforce Commission to get you all certified and recertified, to present your products and services, to find new product and service opportunities, to doing marketing, all the accounting, training and education, allocation of orders, everything to keep the to keep the state use program moving. Okay, TWC staff technical desk reviews. This is something that TWC started 2 years ago, where Kelvin and Howard will visit your CRP to review some of your materials. They would have me tell you this is not an audit. An audit would be much more intense. This is just a review. It would be much more comprehensive. This is just a review of these documents that as a CRP certified through the program, you should you should be keeping on your employees. They will give you plenty of notice. They're not going to show up in the middle of the night and climb in the windows and start taking your files. They'll give you a call, let you know, try to schedule a time that works for you, works for everybody. Come in and review this documentation. If upon the desk review there is information that's lacking, they're not going to have you lock your doors and shut you down or cancel your contracts. They're going to give you time, depending on what the situation is, to get that information in order. And then either TWC or maybe WorkQuest will come back and review to see that you've got all that documentation in order. Now, if it continues to be an issue, that's something where TWC might take further action. The goal is to have every CRP have a desk review for every CRP within 3 years. They've started this 2 years ago, so if they haven't been by your CRP yet and performed a desk review, I would think that it would be within the next year. You'll be getting a call from Kelvin or Howard saying they'd like to schedule a review. So let's go over what they're looking for. It's not a surprise. They're not trying to get you. They're going to lay out everything here. And then we can provide this information as well to the attendees of this webinar. First, an alphabetical list of direct labor employees with disabilities. an alphabetical list of indirect labor employees with disabilities or those that you've placed in competitive integrated employment. An alphabetical list of direct labor employees without disabilities. Your state use files containing your approved documentation of disabilities form for each employee with a disability. And this would be employees with disabilities working on state use contracts. We'll go over this form in a little bit and what's required there, but that's something they're going to want to look at for all of your employees with disabilities working on state use contracts. A plan for integrated employment and a person-centered plan for each individual with a disability. So we'll talk about this a little bit more with recertification, but that is one of the recertification requirements that TWC adopted 2 years ago, is for each CRP to have a person-centered plan on file for all individuals with disabilities. They're going to look at your direct labor ratio to make sure that you're hitting that 75-25 direct labor ratio. A copy of any changes to your articles of incorporation or your bylaws if they've changed since certification or your last recertification. This is for individuals using that 14C certificate. A list of all hourly paid employees who are paid less than $7.25 per hour and the corresponding documentation and justification of the wage rate. That's only if you're paying those sub-minimum wages. Again, for those same individuals, copies of the current prevailing wage rates, time studies, and corresponding piece rate sheets for all operations on which any employee is paid special minimum wage. And finally, for those special minimum wage CRPs, a copy of the agency's current certificate authorizing special minimum wage payment 14C. This next item is for everybody again. Documented health and welfare benefits and records indicating the payment of health and welfare benefits. They'll be looking at 2 periods of payroll records from the previous quarter. They're going to be looking to ensure that you're maintaining payroll, HR functions, accounting, and all relevant documentation showing that the employees who produce products or perform services under the state use program are individuals with disabilities. You can see that is taken straight from the rules. And finally, a copy of your current certificate of insurance. So when you get that call from Kelvin or Howard or TWC staff saying that they're ready to come out and do a desk review, don't worry, but do take it seriously. This is how they're making sure that we're in compliance. We're all in compliance with the requirements of this program to help strengthen this program, to make sure that when other people come around, if anyone else were to come and take a look at this program, that we have all of our ducks in a row and that this program remains so strong and above reproach in its employment of individuals with disabilities. All of that is in the statute and the rules. So if you're looking for how to find them, the state use statutes, chapter 122 of the Texas Human Resource Code. And then the rules are found in Texas Administrative Code, Title 40, Part 20, Chapter 806. If you are having trouble falling asleep at night, I would point you to our website or TWC's Purchasing for People with Disabilities website, where both of those documents can be found. We have hard copies as well that WorkQuest can provide you. I will say, while they're not the most thrilling read, the rules and legislation never is, it's very important as a CRP to understand all aspects of this program, what's required of you as a CRP, what's required of the CNA, the customers, the Workforce Commission. So I really would encourage everybody to make themselves very familiar with the statute and the rules. I have my little copy here at my desk that's highlighted and dog-eared that I'm always referring to just see exactly what the legislation and what the rules say. I would like to point out, I mentioned earlier that our website is WorkQuest.com. When we initially rolled out WorkQuest as our new corporate name, that website wasn't available, so we had WorkQuestTX.com. It's since become available, so you can either go to WorkQuestTX.com, WorkQuest.com. You could go to tibh.org. They're all going to point you to the same website. The same could be said with email extensions. Okay. A bit of a legislative update. For those of you that follow it, you know that the legislature meets every 2 years. They just finished at the very beginning of June, their last legislative session. It runs from January to the very beginning of June. I know everybody's excited that that session is over. There were a number of bills introduced that would affect the state use program. Briefly, I'm going to go over a bill that did affect the program. There were multiple bills filed that tried to eliminate sub-minimum wage, those 14C wages. One such bill, SB 753 by Huffman, did pass and was signed by the governor. So here's what that bill does. It's effective September 1st of this year. It affects all CRPs paying sub-minimum wages. So CRPs paying sub-minimum wages on state use contracts must increase those employee wages to the federal minimum wage by September 1st of 2022. So as of 2022, there will be no more 14C wages as a part of the state use program. Now, if the CRP is working to make that transition of those wages, but just hasn't been able to get it done in time and does have a plan in place to transition those employees to the federal minimum wage, TWC at its discretion can grant an up to 12-month extension. But that's something that the CRP would work with TWC on. And TWC will be working closely with all of CRPs affected by this. Because the next thing that the legislation says is TWC shall assist CRPs in developing a plan to increase wages to federal minimum and then assist with job training and employment services. So the goal is to retain those employees at your CRP if this affects you, but if you are unable to retain those employees at that minimum wage, then TWC under this legislation is directed to step in and assist you with any job training or employment services for those individuals with disabilities to see that they get placed out in the competitive integrated environment. And as a note, this only affects your state use contracts. This bill is not all encompassing, it's only for state use. So this does not affect the commercial payment of those less than minimum wage or special minimum wage. That really was the big piece of legislation affecting the program. There were some little things here and there. The annual reporting requirements for TWC changed. We'll go over that with the state use wage report. But really, the elimination of sub-minimum wage as part of the program by 2022 was the big piece of legislation that passed. Something I want to bring up that I don't know if all CRPs are aware of. We have a good number that are aware of our grant opportunities and use them when necessary, but I want to make sure everybody's aware of the grants that we offer at WorkQuest. The first one being the WorkQuest Technical Assistance Grant. That grant is for equipment or other supplies that you would need for fulfilling your service contracts or your products. So if you have a new product you'd like to roll out and you need some equipment to get that started, you can apply for a grant. The same goes for services. Say you need new lawnmowers or a new van or some new computer equipment for the office. We've also done training for like custodial service training, things like that. You can apply for technical assistance grants. Traditionally, the ceiling on those grants has been $5,000, but that doesn't mean if you need something that's $7,500 not to submit. Submit whatever you need, and then we'll work with you to see if there's money in the budget, money left in the grants, how many have been given out. Maybe we can work with you to get you that amount you need, but traditionally the ceiling has been about $5,000. Our second type of grant, something we started last year, this is the WorkQuest Employment Services Grants. This is to get job skill certification through the UNT-WISE program or some sort of equivalent program, getting training for your staff to provide job skills training, support employment services, and director training to your employees with disabilities. So if you currently have that, you need some additional hours, you can talk to us, or if you're interested in that kind of certification for one or two of your employees on staff, I'd encourage you to get with Christina Bryant, our compliance specialist. You can see her email address there, but to see what's available so you can take advantage of these grant opportunities. Okay, now the fun stuff. Let's talk about your state use requirements. What's required of you as a CRP to participate in the state use program? Well, there's quite a few of them. It's a government program, so you can expect a certain level of bureaucracy and forms that need to be filled out, and this program is no exception. You've got your recertification. Every CRP has gone through certification. You have to be recertified every 3 years. That's something that we've made available through our online portal, where you can actually submit documents through our online portal. You've got your state use wage report. That happens quarterly. Again, that's submitted via the online portal. You've got your set-aside agreement with WorkQuest. That's our contract with each other. You fill that out annually. All your documents for your employees that participate in the program, those are your employees with disabilities. You've got your documentation of disability forms. So what that entails are your disability certification forms, possibly a disability determination worksheet, if that's the way you document that person's disability. And then for everybody, an employee disability consent form. And then for all these individuals, also a person-centered plan. If you don't know what I'm talking about with the online portal, if you didn't attend last year's training, you've never used our online portal before, we did conduct a very thorough training last year on how to access your recertification and state use wage reports documents. So I'm not going to go over all that again, but if you're interested, you want to read or listen to me talk to you about how to submit all this online, go to our website under documents and links and scroll down to CRP training, and it is the first training, CRP training. CRP training 2 was last year's afternoon session with Dr. Bill Weber from Stephen F. Austin University, and that's got some good information on how to fill out and how to conduct person-centered planning for employees with disabilities. So this documents and links, this is where this training will live also, if you're interested in providing this training for some other employees at your facility. All of our trainings will be on this website. So I encourage you to go and look and see the information we have available there about how to conduct person-centered plans, general compliance requirements, and then how to submit your information. Okay, so let's talk about recertification, something everybody has to go through if you're a part of this program. To continue in the program, a CRP must be recertified by the Commission every 3 years. You will get a letter from TWC stating that your certification is going to lapse, and they'll give you the date and let you know that it's time to begin the recertification process. I encourage you, I implore you, when that happens, to begin collecting this documentation. There's some things here like fire inspections or building occupancy certificates that can take time. And if you read on there, if the CRP fails to respond in a timely manner, the agency may consider suspension of all state use program contracts until that process has been completed. So if you don't have a fire inspection that's been dated within the last year and a statement of unavailability, that will hold up this process. The Workforce Commission will table you because they're going to want to see a completed recertification packet, not just a partial packet. And when that happens, when you're tabled, if your certification has lapsed, you can't add new products, you can't add new services. So you're not able to grow as a CRP and employ more people with disabilities. So again, when you get this notice, please take it seriously and put it at the top of the pile on your desk. Because I know things that I put at the top of the pile on my desk quickly become the bottom of the pile. So make sure that stays on the top and that gets done. So let's go over what the requirements are as part of recertification. Well, your CRP requirements are, this was in the staff desk reviews, maintaining your payroll, maintaining your HR and your accounting and all your documents, showing that the employees who work under this program are individuals with disabilities. Those documents need to include the approved disability determination forms that are signed by the individuals and document their disability. Those are reviewed at the request of the agency or the CNA under the authority of the Commission, with adherence to privacy and confidentiality standards applicable to the CRP. So when will we as the CNA come out and review those documents? Well, if you get a new service, a new service contract, if you start a new product, we'll come out. If it's your recertification time, we're going to come out and check your documentation of disability forms. And then we also every quarter do random reviews. So you might get called for a random review where we come and we'll look at a certain product line or a certain service contract and want to see that documentation of individuals with disabilities and make sure that it has been signed by the individuals with disabilities as well. Now, we're not going to actually look at that signature, but we're going to look at that main form that we'll go over in a little bit. And the final general compliance requirement is to maintain and dispose of records or documents required by the agency, including contracts with other entities in accordance with generally accepted accounting principles and all laws relevant to the records. But what do you have to submit? What are your recertification documents that you submit? Well, here's everything you have to get together and submit through our online portal. A copy of your IRS nonprofit determination, your 501c letter. Now that's something we at WorkQuest might have on file. Check with Christina. If you're a government entity, obviously you wouldn't have a 501c determination letter, but we need an IRS determination letter. We need a copy of your articles of incorporation issued by the Secretary of State. That's what we're looking for. That is under your purpose section. The purpose of your corporation is to employ individuals with disabilities. We'll need a list of your board of directors and your officers with their names, addresses, and telephone numbers. A copy of your organizational chart, and that needs to have job titles and names. If you're a large organization, say like Goodwill, and you have your retail services, maybe you have a charter school, you have all these other facets of your organization, we need the vocational rehabilitation portion of your company that deals with state use contracting. Insurance, we'll need a proof of your current insurance coverage, your liability insurance, your auto insurance for any vehicle owned or leased by the CRP that's used for state use contract purposes, and then if it's required, your workers' comp insurance or legally recognized equivalent. So if you have TxDOT contracts and you're required to have workers' comp, we need a copy of that insurance. Has to be with a company that's authorized to do business in the state of Texas, and if you're going to cancel it or have any material change to your policy, you got to provide that to the CNA, that's WorkQuest, within 10 business days of cancellation or change. So make sure that you submit that to us. It has to be dated within, or this insurance has to be current. So if it's going to expire within 2 months of TWC's review of your documentation, you've got to send in a letter stating that you plan to renew your insurance and then give that insurance to TWC when it becomes available. If you send a letter, if you don't send a letter and your insurance lapses, or you send a letter but then we never get your new insurance, TWC could take further action. So they could suspend you, they could make you go through the recertification process again. That's just not something you want to happen. So stay on top of when that when that date of expiration is for your insurance coverage. Next, we'll need a fire inspection. This is the most difficult one. I tell you, if you haven't had a problem with this, many CRPs have. If you have had a problem with this, you are in good company. We have to have a fire inspection certificate within the last year, dated within the last year, where every location where customers will be served or where individuals with disabilities will be employed. That is very confusingly written. We don't need a fire inspection certificate for your customers' facilities. So if you work at a TxDOT location, if you're doing reception services for TxDOT or HHSC or grounds maintenance at TxDOT, we don't need their fire inspection. This is for locations that the CRP owns or leases. So just your facilities. But any facility you have where individuals with disabilities are served, we need a fire inspection within the last year. If you're unable to get a fire inspection, we have to have a statement of unavailability from the city, county, state entity, whoever that is that won't issue the fire inspection. So if they say you're outside of the city limits, we don't perform inspections there, or we perform inspections every 3 years and you just had yours last year, we're not coming back out, that's fine as long as we can get a statement of unavailability, and it can't be from WorkQuest, it can't be from you, it needs to be from that entity. This is the one you really have to get on top of. Sometimes there's a backlog. It takes them a long time to get out to your facility. If they do find a deficiency and they then have to come back to make sure that you've corrected that deficiency, that could be added time. So I always say day one of getting that notice of recertification, put eyes on your fire inspection and make sure that that is current. We also need a copy of your building inspection certificate or your certificate of occupancy, again, if that's required. If you can't get it, a statement of unavailability from the appropriate city, county, or entity. So any location that you have a fire inspection, we should also have a building inspection or occupancy certificate. That won't be dated within the last year, probably. It doesn't have to be. It could be dated from, it could be 1975 that that's dated. So it doesn't matter when it's dated, but we do need to see that certificate of occupancy or your building inspection certificate. For those CRPs who are paying special minimum wage, a copy of the wage exemption certificate, if below minimum wage, will be paid to customers or individuals with disabilities will be employed. And then accompanying that certificate, we need a statement of explanation of the circumstances requiring subminimum wage. So what contracts are you using? What are the individuals with disabilities? What work is being performed under that 14C certificate? We'll need a notarized statement that you agree to maintain compliance with the 75-25 labor requirement. So all direct labor performed by individuals with disabilities will be at least 75% of your labor. This is just for state use contracts. The Workforce Commission isn't concerned with your commercial or federal services. So we will collect that information and I'll show you how that's done. But when we're looking at 75-25, we're just looking at direct labor for your state use contracts. Finally, this is the newest requirement. An applicant for certification must attest that it either has already developed or will develop within 90 days of certification a person-centered plan for each individual with a disability it employs that clearly documents attainable goals and describes how the CRP will help the individual reach their employment goals and match the individual's skills and desires with tasks being performed for the CRP. So our training last year that Dr. Weber provided talked about how to sit down with your employees and their support group and develop this person-centered plan to find out what their employment goals are and find how you can match those employment goals and their skills and desires either within your CRP or ultimately transitioning them to competitive integrated employment. There is at this time no standard person-centered plan available for the program. This is something that all CRPs do differently. You might have something that you use, a specific form. We ask that it be documented in some way. To that end, after having this as a requirement for a few years, and I think as going out and performing these desk reviews and getting feedback from the CRPs, TWC is beginning the process of developing a specific state use person-centered plan. So it will be a specific person-centered plan that each CRP is required to fill out for their employees with disabilities to track their employment goals and see what's being done to meet those employment goals. Again, it's not in place yet. We'll let you know. We'll provide training on how to fill it out when it does happen, but know that that is coming down the pipe. So we will have a standardized form at some point. There isn't one now. Again, I'd point you to that training from last year that's on our website, or if you just Google Health and Human Services Person-Centered Plan, that will take you to the Health and Human Services Commission here at the state of Texas. They have a lot of resources on how to develop a person-centered plan. I was going to include a link in my presentation, but it's just a bunch of gobbledygook as a link, so it wouldn't really be good for anybody you wouldn't be able to write it down or whatever. So the best thing, just Google Health and Human Services Person-Centered Plan. It's at the top of your search. But they have a form there that'll show you how to fill one out and give you a lot of good information on developing that for your employees with disabilities. Because this is a requirement of the program. And I think this, if Kelvin or Howard were here, they would say that this is the biggest thing that they've seen lacking when they're going out and doing those desk reviews, which is understandable since it's a new requirement for the program. But after the first round of reviews, they're going to expect this really to be in place for all individuals with disabilities participating in the program. Okay, just briefly, a reminder on where the documentation portal exists. So if you go to our website, WorkQuest.com, At the top, you'll see CRP documentation portal. If you click on that, it takes you to that page. On your left, you've got your state use wage reports, and then on your right, you've got the box for application for certification and recertification. So I will spare you and not go through any more on how to log in or upload documents there. We have last year's training for that. This is what a completed recertification application looks like. I'll go through it page by page. Know that when you're filling this out via the portal, it's going to prompt you for these questions, so you're not going to see it like this. You won't see it like this till you're done filling out all the questions, and then it generates this form. So we need your certification number, your name, your employer identification number, some general information about your CRP. If you look at the bottom of the page, we need to know who negotiates and signs contracts, who's compiling and submitting reports, who's over personnel management, so we know, TWC knows, who at your facility to get a hold of if we have questions. The second page talks about what the services or products you provide as a CRP. Are you doing temp services, products, or services? The current number of people you have at your facility and the types of services and products. It's also asking, is your location fully accessible for individuals with disabilities? Now the bottom part, that's information that WorkQuest compiles, so you don't have to worry about that. Page 3 at the top is a listing of all of the documents we just went over, everything that's required to be attached to this. And then it asks if on file you have your documentation of disabilities for all of your individuals with disabilities. Page 4 is where you're attesting to that requirement of a person-centered plan. Yes, you have one or will have one in place within 90 days of recertification, or no. And if you do not and have no plans of doing that, why? Please explain. The final page, page 5, is that that signature page that has to be notarized, where you're affirming that you will comply with the 75-25 requirement. This form you actually download and print off from our website, sign it, get it notarized, and then scan it in and upload it back into the portal. So this one you can't fill out online because it has to be notarized. So just be aware that this form will actually have to be printed out. Okay, again, I can't stress this enough. Make sure when you get that recertification information to fill it out as quickly as possible. We can work with you on that. Marie Richter is our Director of Administration. Christina Bryant is our Compliance Specialist. They work very closely with CRPs in getting these certification applications and recertification applications submitted to TWC. Also, your region managers are always available to help you work through any questions you might have. Moving on to the State Use Wage Report. CRP shall submit quarterly wage and hour reports to the CNA. These reports are due no later than the last day of the month following the end of the quarter. So we just had a quarter end. The program's fiscal year has always run from July to June. So since this quarter just ended, that means your next state use wage report is due July 31st. That will be changing. One of the changes in legislation that affects TWC is they're now combining all of their annual reports for their different programs into one annual report. And something they've been wanting to do for a while is to get our program on the same reporting period as their agency. So starting this year, the state use program will be moved to the state's fiscal year. That is September through August. So quarters will be September, October, November, and then so on, which means that we will have 2 months this July, so this month and next month, which won't actually fall with any reported quarter. We're still going to collect that information. You'll be getting a special state use wage report that's just for those 2 months, and then starting September 1st, we'll start the 2020 fiscal year, and then from then on, report using that time frame, September to August. So just letting you know that's going to change. So you will see a special quarterly report at the end of August that you'll have to fill out. If you fail to submit this report on time, they may request a representative of the CRP to appear before the agency. And I'll talk about what happens a little bit if you don't fill this in or you're not meeting your 75-25 requirement. I will say this is one of the most important things we have. This is how we really get good information about the program, about the people we're serving, and the positive impact on individuals' lives that are a part of the state use program. So please fill this out in a timely manner as accurately as possible. Again, the documentation portal, the state use wage report is the big box on the left. Okay, this, much like the recertification application, it won't look like this when you're filling it out. It'll be a series of tabs and prompts that you will fill out. But then when it's completed, the system auto-populates this form and will send you a copy. So let's go over state use wage report and what we're looking for. The first section is labor and wages, specifically direct labor and wages, direct labor hours and wages on state use contracts. So the first section is state use contracts only. We're not worried about your federal and commercial services. This is where we get that 75-25 number from. So your direct labor wages paid to individuals with disabilities, and then benefits paid by CRPs for individuals with disabilities. This is mandatory and non-mandatory benefits. So a mandatory benefit would be something like FICA. So we used to report these separately, where you would have your wages and benefits together as one number. Workforce Commission has asked that we separate these out into two different totals. And then you've got your hours worked by individuals with disabilities there. Below that, Workforce Commission is trying to collect data on the types of non-mandatory benefits that are paid by the CRP. So you can check any of those boxes that apply, and then that information is reported in the annual report as well. So the first section is for individuals with disabilities. The second section is your direct labor and wages for individuals without disabilities working on state use contracts. Again, broken out with wages and benefits and including FICA, and then the type of benefits that are provided and the hours worked. So later on in the form, we'll take these numbers and the application will determine whether or not you're hitting that 75-25. So the software will do that, but that's where we gather the information. Next is our employee tracking. The example we're looking at here is the second quarter. On the first quarter's form, it's going to ask for a starting number. So it has been the start of the fiscal year, which was July 1st. Now it'll be September 1st. We'll ask on September 1st, how many individuals with disabilities are working on state use contracts, so we can get a starting baseline. And then every quarter we will ask how many are added, so we will know in total how many individuals' lives are being affected by this program. We're not interested in how many individuals you're losing. We're interested in just those you gain. So first quarter we'll ask how many started on September 1st, and then we'll also ask how many were added throughout that quarter. So you've got, since this is quarter 2, you've got how many individuals were added during the quarter, and then a disability breakdown. And then at the bottom, the number of individuals without disabilities working on state use contracts added. So that's where we get that number. Now the system will automatically, or will know if your math is incorrect. So if at the top you have 10 individuals with disabilities added, but on your disability breakdown it only adds up to 9, later on when you try to submit this for certification, it'll kick it back and say, hey, you have a problem in tab 2, you need to go back and check it. So you can go back and see that your math or whatever was wrong. So that's a nice feature of the system that kind of helps eliminate those mistakes where we push in the wrong numbers, or maybe we're looking at the wrong sheet of paper, whatever that may be. The next section is just for those CRPs paying sub-minimum wages on state use contracts. So it's going to ask you if you paid sub-minimum wage below $7.25 per hour, which is the current federal minimum wage. If you did, then you fill the rest of this out. How many individuals does that affect, and what are the wages? What are the hourly wages? Again, if you're not paying sub-minimum wage, you don't click this, and then you move on to the next section. Now outplacement. The outplacement portion of the state use wage report has grown over the years as the Workforce Commission is trying to gather and break out more information. Traditionally, we used to have one section that was how many individuals with disabilities were either outplaced or promoted, had upward mobility within your CRP. It was your whole facility, and it was both that left your facility for competitive integrated employment and moved up out of your direct labor into management positions or whatever that may be within your CRP. Well, now we're splitting all of that out. So the first way we split that out is how many individuals with disabilities from your CRP have been placed in competitive integrated employment for your entire company. So we're not just looking at state use contracts. This is your whole facility. How many were placed in competitive integrated employment? The number of those individuals, the wages that they're earning, and then the hours and the type of disability. So you've got your entire facility, competitive integrated employment. Then you've got, of those individuals placed in competitive integrated employment, how many were previously working on state use contracts? So this number will be either the same as that previous number or smaller. So out of those individuals, who was on state use contracts? The Workforce Commission is trying to gather data on how many state use employees are actually leaving the program and going out and working on competitive integrated employment. And for that, we're collecting, again, the number, wage range, hours, and type of disability. That'll be collected on everybody in this outplacement section. The third section is your total company, but it's upward mobility. How many individuals with disabilities have been promoted within the CRP for this quarter? Again, the number, the hours, the wages, and the type of disability. And then finally, of the individuals listed in the previous section that were promoted, how many previously worked on state use contracts? So now we can see of those state use employees, who's moving up in the CRP, who's being promoted. The number, the wage range, the hours, and the type of disability. So it's a lot of information, but all of this will be reported in the annual report. The next section is total company direct labor hours. So your 75-25 won't be based on this, but all your contracts, federal, commercial, state use, what are the direct labor hours for individuals with and individuals without disabilities? The last section is your 75-25. So from section 1, it will automatically calculate there in the box what your direct labor percentage is. Whether it's, if it's above 75, you're in good standing. If it's below 75, we'll talk about that in a second. You enter your name, submit an email address, submit it. Again, this is when it would kick back and say that you have an issue with the numbers on your report. But if everything's good to go, you'll get that email and it'll say it was submitted successfully. And you can always go back in the system and look at this. Now we do lock, after the end of the quarter, we do lock these forms so they can't be edited again, because those numbers then live there. But if you found out there was a mistake, you can always contact WorkQuest and we can go in and make those changes. We don't want wrong information to continually live in this report just because the reporting period has closed. So let us know if that does happen. So let's say that you fill all this out and find out that you didn't hit that 75-25. What happens? Well, you're not just booted from the program. If you fail to meet compliance requirements without a waiver from the agency for 2 quarters, you should submit a written explanation. So first time it happens, you fall below that 75-25, you're going to get a letter from Roxy Van Loo, our Director of Sales. It'll be co-signed by the Workforce Commission. It'll say, just to let you know, you were out of compliance. Now, if that happens a second time, they're going to ask for a statement of why that's happening, and they're probably going to want a conference call to talk to you about why you've been out of compliance for 2 quarters. Now, this is any 4-quarter period. This isn't a fiscal year. It's a rolling 4 quarters. So anytime within 4 quarters you're out of compliance, TWC is going to want to talk to you about what your plan is for getting back into compliance to get above that 75-25. Now, if this continues to be a problem, they could take further action. You could be suspended. That has never happened since we've fallen under TWC. They're very good at working with CRPs to work through these issues to make sure you can maintain compliance requirements, because they want you to keep working as well, and they want you to keep employing individuals with disabilities. So you get your first letter of notification. Your second letter of notification comes from TWC. You send a response letter. There's a conference call between TWC staff, WorkQuest, and the CRP, and then that's where further action could be taken by TWC. Okay, next we'll talk about your documentation of disabilities forms. We talked about that before as a requirement that you have to have your documentation of disabilities for all individuals with disabilities that work on state use contracts. This is something that the Workforce Commission will look for when they're doing their desk reviews, and that the CNA will look for when we do our documentation of disability reviews as well. Your necessary documentation, you have to have your disability certification form, one of these on file for each employee with a disability working on state use contracts. This has to be signed by the CRP director or designee. Let's take a look at that form. This is your disability certification form. The most recent form at the bottom should be dated 7/21/17. So if you're looking at a form that doesn't say 7/21/17, you're looking at an old form and they're going to ask you to fill it out again. As long as you have a current form on file and that individual's disability status hasn't changed, you should be good with this form. So you've got your CRP name, your employee or client number. We don't want to see any names on there because this form actually will be reviewed by WorkQuest, whether they're full-time or part-time, hire date, termination date, and the type of work that was performed by that individual. How were they referred? A state, governmental, or local social service agency, a VR specialist, completing the DDR disability determination worksheet. We'll go over that in a second. Or was it another referral type? So did a VR agency send you this employee? Was it a VR specialist who filled out this documentation of disability worksheet? Or was it another type? And we'll go over the other acceptable types of referrals or evaluations for disability. You've got your medical doctor, your psychiatrist, psychologist, ophthalmologist, optometrist, proof of your SSDI benefits. Yeah, Ability One program has their own evaluation form. If you have one of those evaluation forms, that will work, or some other type of professional evaluation form, whatever that may be. So those are the types of disability documentation that you would have on file. Okay, and then on section 9, you indicate how they qualify. Was it a referral from a state or governmental or social service agency? Did you get a VR specialist to fill out their disability determination worksheet? Or item 7C, was it a licensed professional like a doctor or an ophthalmologist, a medical doctor, ophthalmologist? Was it SSDI benefits, something like that, that showed that this individual has a disability that impedes them from maintaining gainful employment? This must be signed by the director or designee, printing their name and title. And accompanying this must be the employee disability consent form. This is the form where an individual with a disability or their legal representative consents to being counted as a person with a disability for this state use program. So you may know they have a disability, but they have to be consenting to be counted as such under the state use program, or their legal guardian has to consent to that. So I talked about the consent form. You have to have each one on file, signed by a legal representative or that employee. This is what that form looks like, where they just say that they've reviewed the disability certification form dated and the date of that form and understand that they'll be counted as a person with a disability, where they sign it and then their legal representative signs it. So make sure you have one of these on file as well. This is something new. I believe the form should be dated 7/21/17 as well. So make sure you have that up-to-date form. And all of these forms are available on the WorkQuest website under Documents and Links. Then finally, you won't have a disability determination worksheet for everyone. Now, if you have the doctor wrote a letter, gave a referral, VR gave a referral, you have the SSDI benefits, you won't need this. But if a VR specialist is filling out this worksheet, this is the worksheet you will use. It's a 4-page form that goes through the different types of indicators of disability or impairment: visual, mobile, self-care, self-direction, work skills, work tolerance, interpersonal communication, and then the determination that is made. Right now, there is not a standard qualification that the Workforce Commission has considered someone to fill out this form. It's just a VR specialist. So you would put your qualifications there. I will say that Workforce Commission has been looking at this for a while and looking at what kind of qualifications they could require for filling out this form. But at this time, there are no set qualifications. And you would also have the signature of the employee or the legal representative on this form to show that they understand the determination that's been made. That's all for your documentation of disability. Again, we're just going to look, as WorkQuest, look at that first form that we went over to see if you're in compliance when we do a random review, when you get a new contract opportunity, or when it's time for recertification. The state use set-aside servicing agreement, this is filled out annually between your authorized representative and our CEO, Fred Weber. This is about that time that it'll be coming in. I'm looking at this form. This is actually the old form. There were no material changes made, but the new forms that you're all filling out this year, instead of TIBH, they say WorkQuest. So it'll be dated earlier or more recent, and it will say WorkQuest. But again, there are no material changes to the state use servicing agreement this year. Okay. Product and service contracting. Something new that is being required this year of WorkQuest is between the Comptroller's Office. SPD is State Purchasing Division of the Comptroller's Office. They host all of our products on Texas Smart Buy. Under the statute and the rules, it actually says they make the award. So they help TWC determine the fair market value, and they're actually hosting our products on their website. They also host a number of our services, document destruction, temporary services, our statewide services that are open to all state agencies, all go through the Comptroller's offices. Now what we're talking about does not affect your individual contracts. So if you have a contract with HHSC or a contract with TCEQ to perform services, it doesn't affect that. These are those statewide contracts and products. SPD this last year realized that they don't actually have an agreement, a contract in place with WorkQuest. They're hosting all of our products, but they have nothing to hold us to with specification, delivery, anything like that. And all we have with the Workforce Commission is our main contract as CNA with the Workforce Commission. So the attorneys at SPD decided that they needed a master contract with WorkQuest. So we will have to develop specs by 2021 for all of our statewide services and all of our products. So that's where we'll need your help as CRPs. So we will have specifications for all of our product lines and for all of our services so that SPD can perform their contract management duties on reviewing these contracts to make sure that we're performing towards the specs. So they could elect to suspend or remove any items from contract for delivery issues, quality issues, whatever that may be. Again, we'll work with the CRPs to develop these specs. There is no master contract yet. That's something that the attorneys at TWC and SPD and here at WorkQuest we're working on to get this agreement in place, but it is coming in some form. It won't affect you day to day, but I wanted to make you aware that this is happening, and we will be reaching out to you all to help develop those specs and make you have you review some of the specs that have been developed. Okay, service contracting. A CRP desiring to provide services under the program must comply with the following requirements to obtain approval from the Commission. So if you do service contracting, I'm sure you're well aware of these percentages. 35% of your contract price for the service, that's your total service price, must be in wages to individuals with disabilities, wages and benefits. So they're going to look at your total wages and benefits and make sure it's at minimum 35% of your contract. Supply costs for your service must not exceed 20% of the total contract price. And then your administrative costs must not exceed 10%. And at least 75% of the hours of direct labor for each contract necessary to perform the service must be performed by individuals with disabilities. The agency may establish a different percentage if they feel that a percentage greater than 75% for the services offered. Now notice that it doesn't say lower than, but they can decide that maybe some type of service, it should always be greater than 75% for past practices, whether other CRPs have achieved the 75% requirement, whether the Commission has established a policy goal to encourage employment in a particular field. So they can look at that and say, you know what, we don't think 75 is good enough. We want the percentage to be 80% on this contract. Now that's not something that they've done, but I want to make you aware that it is there in the rules that they can raise that percentage. So when it comes to service contracting, specifications, you got to read your specs and understand. Don't assume anything. What you may think are the requirements of a contract could be something completely different than what your purchaser thinks. They may not be fully aware of what the specifications are. So when you're justifying your price based on specifications, make sure that everybody involved understands what's required. We're using those specs to justify and negotiate our price. Your price proposal and your cost analysis that you have to submit and fill out and submit to WorkQuest, that's the basis of your price. TWC reviews all of those because it shows how you've allocated all the monies from your contracts. You have to have your set-aside agreement in place to perform contract services. And then you as the CRP are responsible for the training of your staff and clients and also for quality control. This is a service price proposal or cost analysis. Its official title is Service Price Proposal and Cost Projection Worksheet. I've never called it that. I've always just heard it called a cost analysis, but this is what you must fill out and submit on all contracts if you're going to perform services for the state use program. You've got your labor costs. This is direct labor for your employees with disabilities and without disabilities, where you put in their hours, their hourly wage, and total. You'll get the total wages paid to individuals with disabilities and without. And we'll also be able to find out here if you're meeting that 75-25 requirement of direct labor hours. Next is indirect labor. That's supervisory costs, people not performing the actual labor to fulfill the service. You've got individuals with and without disabilities. Again, their hours, hourly wage, and then the total amount of indirect labor. On this third page, you've got your benefits, your FICA, workers' comp, medical, life insurance, and any other benefits that you provide for your individuals with and without disabilities, and then insurance, general liability, vehicle liability, and then if you have some other type of liability, say workers' comp that's required, your workers' comp or other liability insurance. You can amortize equipment, your original cost minus the salvage value divided by the years of useful life. So you can amortize equipment there. You can, if you have to buy a new truck, you can't throw the whole truck into 1 year of this service contract, so you have to amortize that. Your equipment operating costs for your gas and oil maintenance, your mileage, any other equipment that you have, and then your supplies and non-amortized equipment. So your description of the equipment and then the amount related to that. Finally, we have your other expenses, any other expenses that may be involved that aren't captured in the other fields. Your admin overhead, that's going to be, again, no more than 10%. Your contingency, we don't have it listed as profit. A lot of people call this profit, but this is dollars in excess that you need in case something happens, if gas goes up, if wages go up, if you have to perform more cycles than you thought you would. This is the contingency until you can get that price approved. And then you have your subtotal there and your total cost projection. At the bottom, we have the total dollar amount of disabled direct and indirect labor paid to people with disabilities, the number of persons with disabilities employed, and then the total dollar amount divided by the contract amount. So that's where we get that 35% to make sure 35% of the contract wages and benefits are going to employees with disabilities. If you have any comments, you can fill them out there and then you sign it, and the WorkQuest rep will sign it as well. Now this is an Excel spreadsheet. Everything you filled out there was actually pages 2, 3, and 4. Page 1, this information, you'll see the dollars there will auto-populate. So at the top is information about the service contract, the contact person, the agency, start date, type of service, those things. Below that are your actual numbers, and this is auto-populated from the other pages that you're filling out. So your labor, your benefits, insurance, supplies, admin overhead, contingency, subtotal, and then that total cost projection adds in the WorkQuest management fee, which for services is a 6% management fee. So all this information is reviewed by WorkQuest and then compiled into a report for the Workforce Commission. Now, if it's a renewal contract, there's a little more information that TWC is looking for. They want your estimated wages from the previous year and then the actual wages that you paid. So they can see what your estimate was. Okay, we said we're gonna pay $15,000 in wages, but what was actually paid? Well, we actually only paid $10,000 in wages. And then in the comment section, if they're less than the estimate, that's where we're going to want to know, okay, what happened? Maybe not all cycles were completed. Maybe more cycles were added, so there's actually more wages were being paid. What's the reasoning that the actual difference differs from last year's estimated wages? So for your cost analysis, all of your information on your cost analysis is presented to TWC for contract consideration. So contracts can't be signed and completed until we get a complete and accurate cost analysis from the CRP. So make sure you're submitting that cost analysis, make sure it's complete, make sure it's accurate, because if we don't have a signed contract, payment can't be guaranteed. So payment's not guaranteed on contracts performed that aren't signed and without a valid PO. So that's where you as the CRP have to decide if it's worth the risk. We know we don't want to upset our customers if they're not able to get a signed contract back to us, if there's not a PO. That's where we can't tell you to take on that risk. We understand that sometimes there are times when you have to continue, you as the CRP feel you have to continue working to keep that customer happy. But just know if we don't have a signed contract, we don't have a PO, that payment can't be guaranteed on those contracts. So that's a decision you have to make as the CRP. But you can help that process along by getting that cost analysis into us as quickly as possible. This is a TWC cost proposal. So when TWC reviews your cost analysis information, this is the format in which they review it. The top is just information about your CRP, the customer, the type of service, but then you see that cost breakdown. So it's going to take your labor, benefits, insurance, all of that information that was on your cost proposal. It's going to break out all those amounts and then give the Workforce Commission the percentage of the dollar amount towards the total of that contract. So they'll be able to check on your wage and benefit percentage. They'll be able to check on your supplies, your overhead. And then it also tells the number of people with disabilities and the average wage that those individuals are earning. At the bottom, we have your direct labor hours. So we can see what the percentage of the contract is that 75 or above? And then what the little cheat sheet on the right there, what the requirement is. Is it equal or greater to 75? Wages, benefits, equal or greater to 35, equal or less to 20% on supplies, and equal or less to 10% on overhead. You'll see the total number of opportunities for individuals with disabilities, total estimated wages to individuals with disabilities, and the total contract amount. All right, that is service contracting. I will go briefly over the process to get a product assigned. I want to make sure everyone's aware of that process, whether you're currently producing products for the state use program or this is something you've thought of getting into. It's really important that you're aware of what our assignment process is, because this at times has been a struggle for some individual or a point of frustration. We do our best to make sure that CRPs aren't competing with each other on products, the production of products. So it's not like services where you'll have multiple CRPs that are providing janitorial services, landscaping services, reception services, whatever that may be. On the product side, we try to keep the products to one CRP, or if it is spread out among several CRPs, to keep a focus at one CRP or another, a certain type of product. So to that end, if you as a CRP identify a product opportunity you'd be interested to adding to the program, before you move forward with developing that product, you have to request assignment to WorkQuest in writing. That can be a letter or an email. It can't be a voicemail that you leave with one of us, but it needs to go to our R&D director. Our R&D manager is Ray Zaman. You can see his email address there. Our product analyst is Nina Rowdy. you can see her email address there. So before you move forward, please submit that request to either Ray or Nina so we can let you know, yes, this assignment is open, or that we actually have this on contract already. That's happened before. Or we have another CRP, they have this under assignment, and they are developing this product line. Now, just because someone has it under assignment doesn't mean it is their assignment forever. You can request the backup assignment. There is a timeline associated with developing a product. A CRP that has a product under assignment has 180 days to actively develop that product. Now, that doesn't mean that at the 180 days, at the 6-month mark, we don't call you up and say, well, you didn't get it done, sorry. You have to be actively developing it. If you are actively developing that product still, you just haven't been able to get it to the final approval stages, that's okay. We're not going to take it away from you. But there have been cases where CRPs have an assignment, they might have forgotten they had it. Another CRP says, hey, I'd be interested in doing that. We'll call up the previous CRP and they'll say, you know what, we tried to make it work, we couldn't make it work, and they can have that assignment. So if you are interested in something, you can request that backup assignment. If it's a product that we already offer, and let's say a CRP decides, this doesn't really fit our business model anymore, our relationship with our supplier doesn't exist anymore, we're not interested in providing this product. The first place we're going to look when we transfer that product to another CRP is to see if anybody has the assignment on backup. So make sure you request the assignment in writing, make sure you get the backup assignment if assignment already exists, and you will know if you have an assignment because we will send you an assignment letter. You can always contact Ray or Nina to see what assignments you currently have, to see if something is open. And then after you have that assignment, then you work with your supplier to develop that product. So you would develop the product, develop the value added, develop your pricing, and then submit that information to our R&D department, where we work with the comptroller and TWC to guide that through the approval process. The comptroller will do their own fair market pricing research, make a recommendation to TWC. TWC does not always take the comptroller's recommendation, and those commissioners will vote on the product assignment or on products to add it to the program as they see fit. So that's a process that usually takes about 6 weeks. It's something we were doing quarterly before, but we've moved it to a 6-week process under the Workforce Commission. After it's been approved, it goes back to the comptroller and they will develop commodity codes. That's something in the past that has taken time to get those commodity codes assigned so we can get these products placed on the comptroller's purchasing portal and customers can purchase them. But there's some new staffing over there, some new processes at the comptroller, and that's a process that's been going a lot faster. So if you do have issues getting commodity codes, we'll work with you through that process. We'll keep you updated what's going on with the comptroller, but I just want to make everybody aware that that's how the whole process works. That's if a CRP identifies a product. Now the assignment process, if WorkQuest or a customer identifies that opportunity, customer comes to us and says, hey, we've got something we purchase all the time, we think it would be a good fit for the program, do you have a CRP that could provide this product for us? First we'll see if there's an assignment for that product or if somebody's doing something, has something like that under assignment. If not, we'll use some certain evaluation criteria to evaluate certified CRPs. I'm not going to go through all these right now because in a sec we actually have all of these up where we go into them in a little more detail. But I will say that this assignment process isn't just for products. These criteria apply to services as well. So when our region managers and our R&D staff are looking to distribute those assignments and contracts, this is the criteria we use. So we'll identify a CRP, see if they're interested in providing that product. If so, the assignment will be awarded via an assignment letter, and then again, the CRP develops that product and follows the process that we talked about earlier. So what are those assignment criteria? So if the WorkQuest is looking to assign a service or a contract to a CRP, these are things that we will take into consideration. The ability to perform the specifications. Does the CRP have the capability to perform that type of work? Has the customer asked for a specific CRP? There are times where the customer already has a relationship with that CRP and has requested a specific CRP, and we will do our best to meet that request. Now, it might not always happen. There could be mitigating factors, but we will do what we can to meet the customer's request. Does the CRP have adequate financial resources, required equipment or resources to obtain the equipment needed to perform the contract or to take on the product in question? Is there available workforce? Will the CRP have staff in place at the start of the contract to perform the scope of work or have the current availability and capacity to take on new product with the expected volume of the product in question? So the CRP might not be up there, may not be geared up staffing wise for a product of this magnitude. So is that workforce available? Is there adequate supervision? Does the CRP have enough supervision in place to meet the contract or product requirements? The CRP's desire or need to grow. Is this a time that the CRP wants to take something on? CRP is really looking to grow and is making a push to grow, then that would be a good opportunity. Past performance, we'll look at the CRP's been able to meet or fulfill the specifications and requirements of similar contracts and or products. Are you already performing work for that customer? There could be circumstances where providing other services or you're familiar with the customer's expectations where that would be advantageous. Location. Are you already performing service in or near that area? Or is your location prohibited to the production of the product or the service? Could create competitive pricing information with freight or something like that. Those could be issues we work through, but we do need to take into consideration the location of the CRP. And then everything being equal, we do maintain equitable distribution of contracts or products among the CRP. So those are some examples of what WorkQuest is looking at for assignment criteria. This is a product cost analysis. Those of you who are my product CRPs, you should be well familiar with our product cost analysis. This is an Excel spreadsheet that you fill out and submit to Nina Rowdy, our product analyst. On the left is information about the type of product and competitive pricing information. In the middle, if this is a price revision, you'll have all the old cost analysis information, so your old totals. And on the far right there, you see new revised cost analysis. So if it's a new cost analysis, that'll be filled out with your numbers. If it's a revised cost analysis, those will be your updated numbers that you're asking TWC to consider. So I won't belabor the cost analysis, but briefly going over it, we have our product description. This is something where we need to be as detailed as possible on the description, including dimensions, weight, case count, all factors that would let WorkQuest classify this product, perform our fair market pricing research, let the comptroller perform their fair market pricing research, allows the comptroller to assign those commodity codes. Those codes, are based on product classes and commodities, things like that, and then would allow our customers to know exactly what they're getting when they're reviewing these products, when they're searching these products on Texas Smart Buy on our website, trying to find exactly what they're purchasing and what they need. We have competitive pricing information. This is where we look to see if we're meeting that fair market value. Now, as guided by the statute and by the rules, when TWC looks at competitive pricing information, this is what they look at: the amount paid by federal agencies, the amount paid by private businesses, the amount paid by the state in recent purchases, the actual cost of manufacturing the product, usual, customary, and reasonable cost of manufacturing, marketing, and distribution. I will tell you that while these aren't ranked in order of importance, the first place that TWC and the comptroller are going to look is number 3, the amount paid by state in recent purchases. So if there's an existing contract, if there's a TexMOS contract, this is something the state or the customer has been buying, that's what they're going to look at, and that's what they're going to call your competitive price. There was a situation fairly recently where the comptroller was starting to look at Amazon as competitive pricing. We argued that that wasn't an applicable pricing method, and ultimately TWC agreed that Amazon isn't a way that products are available to state agencies, and therefore Amazon pricing isn't applicable under fair market pricing. So it needs to be the way a state could procure a product for it to be a fair market price. We look at minimum orders and your freight message, your delivery time. Freight is a big concern with state agencies. Paying freight, we do try to include freight in all of our products. Recently, we're really encouraging CRPs to go to tiered pricing methods based on weight, based on quantity, to get that freight included in the pricing for our customers. But you can't have a freight message, you can have minimum orders, and that's where you'd enter that information. We have number of people with disabilities employed and the direct labor wages paid to individuals with disabilities. Okay, on your right, this is where we have our breakdown of pricing. You've got your materials at the top, all your material costs. Then under labor, it's broken out into direct labor. That's the actual work performed by individuals with and without disabilities. And any first line working supervisors. So this has to be individuals that are preparing, processing, packaging the items in some way. Also, we have indirect laborers, supervisors not performing any of that direct labor. It totals up your labor and then moves on to overhead and administration, which includes your personnel costs, so salaries and benefits and expenses for your managing staff, your directors, executive staff, payroll, cost center managers, supervisors, clerical staff, admin staff, support staff, those folks that aren't direct labor and aren't your indirect labor supervisors. You have your personnel support costs. These are costs to maintain your business. Office supplies, office equipment, office furnishing, travel, advertising, marketing, things like that. And then your occupancy costs, costs associated with your building, your space utilization, your maintenance, supply, equipment, things like that. That totals up in your overhead administration. Then you've got equipment amortization if you're going to be amortizing equipment under this product. So she'll be limited to equipment items with a value of $1,200 or more and an expected useful life of 3 years or more can be amortized across the life of this product. We have our freight allowance where freight is worked into the price of the cost or the price of the product. And then other, anything we didn't catch in those other categories. On this form, it's listed as minimum profit considered, but we kind of talked about it with the service cost analysis, your contingency, your revenue dollars in excess of your expenses that you need to consider this product. And then it totals it up. This is your cost as a CRP, total cost plus profit. So this is every cost that you as a CRP should be incurring. Then we go on and move on to the additional fees that the customer pays. If you have WorkQuest warehouse an item, we do have a warehouse allowance. We have our warehouse here in Austin where we warehouse a large number of office supply items. Currently that warehouse fee is 7%. If you're interested in having your items warehouse, let us know. That's something where you can ship to us in large amounts and then we can batch items, your products with other items, other orders, and send them out to customers. We actually have a proposal that we've submitted to the Workforce Commission and to state purchasing, where we're proposing to warehouse all of our office supplies, bring in over 100 more items into our central warehouse here in Austin to include freight, or for small orders have a flat $5 freight amount. So that's something we're working with. We'd be increasing our warehouse fee charged to the customer to pay for that freight cost that they would rather see incorporated in the cost of freight than paid on as an add-on. We have our management fee for products. It is 6% like services. You've got your subtotal there, and then finally the Texas Smart Buy fee. Any vendor doing business with the state of Texas selling products has to post their products on texassmartbuy.com. That's the comptroller's preferred method or mandated method of procuring products by state agencies unless they have some sort of exemption. So if you're a vendor on that system, you have to add a 1.5% fee that then the state pays basically to maintain their own system. So every month we have to total up our total charges, our total purchases made by state agencies, figure up that percentage, and submit it to the comptroller. So we add up all those totals and you get your total. That's the final price of a product that's considered for approval by the Workforce Commission. So that's what they're looking at, that fair market pricing. Finally, your cost analysis needs to be signed, your name needs to be typed, and it needs to be dated when it's submitted to WorkQuest. Okay, finally we have our value added statement. Value added is the work that's performed by individuals with disabilities. That's applied to raw materials, components, good purchase in bulk. What is the work that's being done by individuals with disabilities on this contract that makes it viable under the state use program? The one thing you can't do that's specifically written in the rules is pass-throughs are not allowed. Therefore, solely affixing a packaging label to a commodity does not qualify. You can't get a box of something in, keep it in the warehouse, put a sticker on it, and send it out. Put a packaging sticker on it and send it out. Some sort of appreciable contribution has to be made, and that is done through the value-added statement. That's how you represent that to the Workforce Commission. So you want your value-added statement to be as detailed as possible so the commissioners are aware of the work that's done by people with disabilities. So if it is something where you're receiving in bulk and breaking it down into smaller quantities, at what level, of what quantities are you receiving it? How is it being broken down? Are you building the boxes? Is there any sort of packaging information that goes on it that you're supplying? Does it have to be barcoded? What exactly is being done? Are you assembling? What are the steps of assembly? So please, I ask that you be as detailed as possible with this. If we get a value-added statement and it's 1 or 2 bullet points, we're going to send it back and say, hey, we really need you to take a look at this and show the value that's being provided by individuals with disabilities. A brief recap of what we talked about today. The necessary paperwork for CRPs that you have to fill out to participate in the state use program. We have our recertification that we do every 3 years. You submit those documents through our web portal. We have your state use wage report. That's filled out every quarter. That's done via the web portal. You've got your documentation of disability form, one on file for every worker with a disability working on state use contracts. Your set-aside agreement filled out once a year. You have a cost analysis, one for every service contract or for every product line, and then a value-added statement for every product line. So just take a look at this list and make sure that you're doing all of the things bulleted here to maintain in compliance with the program. Be timely, be complete, be accurate. This is very important to our program, that we fill out this information, we fill it timely, we make sure it's accurate, it's complete. This is how you all CRPs maintain in good standing in this program, how this program maintains itself in good standing, and how we report the success of this program in employing individuals with disabilities to not only TWC, but the governor and the legislature. And so we can show that, you know, this is good work. Those 6,000 employees with disabilities who choose to work at a CRP are getting the best value and the best services by you all, the CRPs. And I know you all are doing that, and so I just want to make sure that we're showing that to the rest of the world. Okay, that's the main presentation. I will shoot it back to Dave now so we can get into the question and answer portion.
Thanks so much, Kyle, and we have plenty of time for Q&A before we break for lunch. I see that some of you have already submitted questions. Thank you very much for those. If you haven't, you can type your questions into the Q&A box. So let's jump right into this, Kyle. Our first question is from Mike. The question is, how does TWC have the authority to view CRP employee medical records?
Sure, Mike, we get that question a lot. There are obviously HIPAA requirements, and you can't just be showing your CRP's information to everybody, but TWC actually as an agency is exempt from HIPAA requirements. So when Kelvin or Howard or TWC staff comes in and wants to see those medical records, they are actually exempt from that requirement. So they're able to see that. Now WorkQuest is not. We don't enjoy that privilege. So we don't need to see, and we can't see those medical records. We can't see the signature where the employee has signed the employee consent form. All we can see is that first disability certification form, but TWC is exempt from that requirement.
All right, let's go next to Carol. How often will WorkQuest perform documentation of disability reviews?
Sure, there are, other than when TWC comes for your desk review, WorkQuest will come when you're up for recertification, and we're going to look at all of your employees with disabilities that work on state use contracts, where we're going to want to look at those forms. If you get a new service contract or start a new product, we're going to come and look at that information. We're not going to be there the next day. We'll give you time to ramp up, but we're going to look at the individuals that work on that service or individuals who work on that product line, or you expect to work on that product line, or maybe are working on that product line today. And then finally, we do random reviews as well, where we'll take a few CRPs in a region a quarter and call them up and let them know we're going to come by and perform one of these documentation of disability reviews.
Next question, Kyle. Who do we have to contact regarding the grant applications?
Yeah, Christina Bryant is our compliance specialist. I'll give you her email. It's cbryant, C-B-R, oh, I gotta write it down now. CBRYANT @workquest.com. Or you can call her at the main number, 512-451-8145. Christina is the person to talk to. You can also always reach out to your region manager, and they can get you that grant application through Christina.
Looks like we have one further question, and of course, if a question occurs to you later, feel free to type it into the Q&A box at any time, even if we don't get around to answering your question right now. I'm sure Kyle will follow up with you via email. So Kyle, this next question is from Dan. Will CRPs still need to fill out wage report information for this July and August?
Yes, we will have a special report that covers those 2 months. Even though it won't be part of the official fiscal year 2020, we don't want to lose that information. And I'm sure we're going to work with TWC in some way to maybe report that information. But we want to make sure that it's not lost, the wages, the hours, the number of people that are working, so we can get a complete picture of what's passing through the state use program.
Okay, so thanks for the questions. Like I said, if a question occurs to you later, go ahead, type it into the Q&A box. Before we break for lunch, Kyle, any additional remarks?
No, I appreciate everybody attending this webinar. Again, it will be available online on the Documents and Links portal on the WorkQuest website. So thank you all. If you do think of any more questions, if you think of any more questions, my email, kradford, KRADFORD @workquest.com. You can always email me directly, or as Dave said, you can type them into the Q&A box there. Or you can call me. I'm at the main office, 512-451-8145. So we want to keep this a continuing dialogue. Anytime any questions do come up, let us know. And some of the things we talked about coming down the road, we'll make you aware of when those and if those changes take place as a part of the program.
All right, and we're going to add a little bit of extra time to your 60-minute lunch break, and then we'll be back again for the second part of today's event at 1 p.m. Central. So enjoy and